Hi, everybody. I am Dr. Selina McGee, and I practice in Edmond, Oklahoma. I'm in private practice, Bespoke Vision, and I am here sharing lots of good conversation with my good friend, Dr. Walt Whitley, and I will let him introduce himself. He is someone that I have admired from afar, and we're going to share some awesome things about tear osmolarity and dry eye. And Walt is somebody that takes the key of brilliance is simplicity. And we're going to talk about some of those things. So Walt, I'll kick it to you to introduce yourself.
Hey, Selina. Hi, everybody. My name is Walt Whitley. I am the Director of Professional Relations and Education at Virginia Eye Consultants in Norfolk, Virginia. And one of my passions is ocular surface disease and dry eye. And so having this conversation with you, Selina, very excited about to talk about our experiences when it comes to bringing in innovative technology and how it makes an impact on our patients, how it helps with our diagnosis, but also our management, because that's something we have to look at whenever we are bringing in technology is, well, how is it going to make a difference on our patients? How is it going to make a difference on our practice and utilize it to the best of its abilities?
And I think it's so important that we have a conversation around the companies that we do work with. And, you and I are going to talk about True Care Medical. And we've worked with this company for many years. They've gone through a rebrand, and most people would know it as Tear Lab. But, what do you look for in a partner when you are bringing in new technology? I think that's key to this conversation.
Yeah, it's always important to take a look at the technology. We know there's always going to be something new. There's always going to be new partners within the industry. And it's important for us to learn about it, right? Get to know them, see what some of the science says and what not some, all the science says. And, what can we do with it? And what is the benefit to the patient once again? It has to have some clinical utility or it's not going to work. But get to know them, meet with them, learn about the technologies, talk to your friends like you and see what your experiences are. But just, how are they going to support me and my practice? And that's one of the things that I found working with various companies, support those who support you, but also who helps provide information for our patients.
Absolutely. So let's talk more about why dry eye is so important. This is a passion for you and I both, and we practice in very different settings. You're in a large tertiary center surgical setting. I'm in private practice. Tell us why it's important and why you are passionate about dry eye in that setting. And then I'll share a little bit about my story as well.
Not just of my setting, it's everybody. I mean,
It is.
We've talked about before, everybody has dry eye until proven otherwise, or some type of ocular surface disease. And we're learning this about dry eye. We're learning about blepharitis, rosacea, and the various other ocular surface disorders. When it comes to our practice, it's something that we look at for every single patient. We want to make sure no matter if they're there for cataract surgery, glaucoma procedures, glaucoma management, retina, that we actually have protocols in place to identify patients who may have symptoms or have diagnostic signs, whether it's going to be utilizing the technology or some of the traditional tests. But once we identify it, is doing something about it. And so for us, we want to make sure that we are identifying patients, let's go to cataract surgery, who are going to be candidates for some of the multifocal or trifocal technology. And so we want to have the optimal ocular surface to help make the IOL calculations to provide our patients the best optical outcome. And in the end, it increases patient satisfaction. And so that's one big part of our practice, but just the quality of life. And how many patients that you see, it doesn't matter what setting, whether it's your setting in an optometric practice within a referral center, these are patients that are suffering. And so that many are silent sufferers that don't realize the impact that the dry eye has on them. And so, that's how we utilize it within our clinic. My passion, that's how I started my practice. So I get a lot of referrals from our specialists, our colleagues within the area as well. And I make sure I address their condition and get them back to their provider. What about you? I mean, within a private practice setting, we know that there's so many different hats you have to wear: patients' glasses, contact lenses. Maybe it's going to be the aesthetics because you do a lot of that. But then you're dealing with vision insurance and medical insurance. So how does that work for you?
Yeah, so I think you bring up such a good point in reminding everyone that it's really about the mindset of the patient has dry eye until they prove otherwise. And we have to do testing and we have to screen every single patient for dry eye. So that's how I approach it in private practice. Because the reality is, when you have a poor tear film, you're going to have poor vision no matter what we're doing, whether that's spectacles and refractions, whether that's doing contact lenses, whether it's, sending a patient out for cataract surgery, and certainly oculoplastics as well, and then aesthetics. And so there's, no matter what our background is or what practice we're in, this is really key. And so the way that we approach it is we actively look for these patients in every single patient. So we do a couple of things to screen, and one of those is a questionnaire. And because you're right, you mentioned when you talk about, patients are silent sufferers and they don't make the correlation of, oh, this is dryness that's causing me to feel like this. And then moving on even further, when you get into a neurotrophic case, then they don't have any, symptoms because it's been so downregulated. So I always look for simple things that can identify patients early. So a questionnaire is key, but point of care testing is part of that too, because then it's, what can we do before you and I actually walk into the room, right? So our protocol is a speed questionnaire. If they have a 6 or greater on that speed questionnaire, then we're doing point of care testing with MMP9, and then we're also utilizing tear osmolarity. And so I have all that information before I ever walk in to even do staining, tear breakup time, and all the other things that we do behind the slit lamp. So that's been really key for us. And it's been that way since I adopted the technology in about 2010. So for us, that's really been important to maximize patients' vision, no matter what they're in our clinics for.
Go ahead.
Yeah, go ahead.
No, go ahead. I was going to cut you off.
So we talked about, and you asked the question of, do I have patients that are on vision insurance as well as medical insurance? And we do, because lots of patients come in, they're here for their comprehensive exam, and you're asking, okay, but this is a lab test. Well, that's good news, because it is a lab test. So we have a CLIA waiver in place. Because it's a lab test, I can do that in addition to their vision plan reimbursement. It's not insurance, it's a vision plan benefit. I think utilizing phrasing really matters. And then we bring them back for further assessment after we've started implementation of whatever we're going to do on that day. But I don't want patients to wait another 2 or 4 weeks to come back for a medical visit. That's just what we choose to do in our office. But we can easily do that because this is a lab test.
Yeah. Whether it's vision versus medical or whatever the reason for the patient coming in, we have to remember we're judged by our patient's quality of vision. And so that's why it's so important, as you said, utilizing the surveys, utilizing the point of care testing. As we know, when we look at the power of the eye, 2/3 of it is at that corneal tear film interface. And so if we have an irregular surface, if we're not identifying changes earlier in the disease state, I mean, that patient, they're still going to suffer and not get that clear, comfortable vision.
Absolutely. So when we talk about workflow, and we want to maximize not only our patients' visions, but we also want to maximize how we utilize our team around us. So I talked a little bit about my workflow. Do you have it in your workflow where you have standing orders? Walk us through that and how you have your protocols already set up.
Yeah, so we have in a multi-specialty group, we have cornea, we have retina, glaucoma, plastics. And so all patients do get the SPEED 2 questionnaire to identify any of those symptoms. If they have any of the symptoms, then the standing orders are for our technicians to do the osmolarity testing. And let's say the retina clinic. So the retina doctor, he is not going to treat the ocular surface. I know some do, but at least his technician is described will flag that patient. They'll take care of the retina, but they'll flag that patient to get set up for a ocular surface evaluation. And so that is part of our workup for all patients. If we're doing a dedicated dry eye evaluation, it's going to be much different because there's going to be more testing. Everything's going to be included. My imaging of the meibomian glands. We'll do MMP9 testing, staining, expressing the glands. We want to do the core blocky light test, looking for any exposure that the patient may have. And so it's going to be a little bit different, but osmolarity does play a role, whether it's going to be for screening all patients or whether it's going to be in our dry evaluation, but also the management, because I'm ordering the no touch on any follow-ups. It doesn't matter at the initial treatment and evaluation. When I bring that patient back, it's no touch and osmolarity, because I feel that's critical information to determine, is that patient, are we getting control of their ocular surface?
Yes. And now that we have an objective way to measure that, right? That was always my challenge 20 years ago, is where are we in the disease state? Is what I'm doing working? Because we have symptoms, but symptoms don't always correlate with what's happening at the corneal surface. And so when we have an objective test like osmolarity, that gives us so much more information. And to your point, it gives us information at the beginning, but it also gives us information as we continue, because reminding patients this is a chronic progressive disease, we have to know what's happening through their disease process. So I love that you brought that up. And your protocols, the other piece of that is, I think it's really interesting. We have very similar protocols, but we're in very different practices. And I want to go back to that because it just reminds us all that ocular surface disease needs to be identified in all of our patients. And it doesn't have to be a really heavy lift. You can do it with a questionnaire, osmolarity, and meibography, staining, and our slit lamp, right? And when we do it that way and we can simplify things, we have less risk of the wheels falling off as, clinic gets really busy or our technician calls in sick, which we know that never happens in clinic, right? Things don't fall apart. So I love having those protocols in place. So I've been fortunate enough to adopt the new ScoutPro. I know that you've had osmolarity in your clinic for a long time, and I know you're might be jealous over there because I have the new one. But why are you excited? And then I'll share what my technician talked about, because our technicians are the ones doing this, right? So talk to us about why things like portability and how you adopt this in your clinic, why that matters.
Well, it just makes everything more clinically efficient. And so we know that there's so many demands for our staff, for our teams, when it comes to just the normal clinic day. But anyway, anytime that we can make the examination more efficient, that we can get increased throughput with our patients as well, gathering that critical information, whether it's going to be for the diagnosis or whether it's for the management, right? Whenever we get that number, that patient comes in, is it 300? Is it 320? Is it 315? Where is that? Do we have normal osmolarity, normal salt concentration of the tears, or is it elevated? What could have triggered that, and what are we going to do to address that? And so for us, I'm jealous, as you mentioned, because I don't have that. So right now, my team is we have 4 or 5 in our main clinic downstairs. We have about 25 exam lanes. So they're running to the machine, getting the device, getting the sample from the tears, bringing it back, and so that's just more time. Yep. Where if we had the handheld unit, wow, look at that, how high tech it was. All this information, no one ran out of the room. You had all the information you need. It was portable. They gave you the clinical information, and I'm jealous.
I asked my technician, I was like, okay, so tell me why you're excited about having this. And he's like, oh my gosh, Dr. McGee, I don't have to run across the clinic. It's in my pocket. I can do all of it literally in my hand. And so he was super excited about this, because my dry eye lanes sit on the opposite side of the clinic because we use it so much in our primary care clinic. And so it's been a really good addition. And like you said, time really is money. And when we have that throughput, we're always looking for how do we improve efficiencies. And this is one way to definitely do that. So here's a great question. Why do you test for osmolarity in the first place? Why does that matter to you?
Well, going back to osmolarity, we're looking at the salt concentration of the tears. Are the tears in its normal balance? And if it's not, what are we going to do about it? And so why it matters to me, it doesn't just matter to me. It helps me with my diagnosis. You mentioned objective. Yeah, it is gives us a number, just like with glaucoma. We don't manage glaucoma and diagnose glaucoma without OCT. We don't do it without objective testing such as visual field. That's the same when it comes to dry eye, looking at osmolarity, looking at MMP9. So this gives us information, early information before. Well, we know that osmolarity is in the definition of dry eye according to TFOS-DUES 2. We know that the effects of hyperosmolarity or increased salt concentration, how it can destroy epithelial cells, how it can be a driver of inflammation if it's not addressed early enough. And then, we always talk about and encourage our colleagues to treat early, identify early, because if we wait too long, that's the more difficult patients to address. And then also those patients long-standing, that leads to more impact on the nerves and perhaps neurotrophic keratitis. And so why osmolarity? Because it gives me objective information I could utilize to make management and treatment decisions, prescribing medications to address and optimize that surface.
I love it. And so same reasons. I like the objectivity of it. It tells me where we are in their state. The other thing that we haven't talked about that I love about it is sometimes it actually gives me information for masquerading or for comorbidities, because if I'm doing MMP9 along with osmolarity and I get normal osmolarity, but I have really high inflammation, then I start looking for masqueraders. Maybe it's conjunctival, maybe it's EBMD, but sometimes the test actually gives you information in the absence of information, if that makes sense. And so for me, this has been mission critical. And like I said, I've had osmolarity and been testing for it for, 13 years now. This is the one piece that I would not want to live without, other than vital dye, probably, because it tells me what's happening with the patient. As we know, this is a chronic disease and things can fluctuate, things can change. Patients can have flares, or they may introduce something new. Because of the chronicity of it, we need to know what's happening at the cellular level, and this objective measurement does that in a precise, practical, easy way for us to implement into our clinics, and it lets us take better care of patients, and ultimately patients have better visual outcomes, no matter if we're doing a spectacle prescription, a contact lens prescription, or referring for surgery and doing a premium IOL. This helps us make sure that their ocular surface is in a premium state so they can achieve the best vision possible. Yeah. Okay. Well, this was a fun conversation. Thanks for hanging out with me. Any parting comments you want to make on osmolarity and TrueCara?
Yeah, going back, it's objective testing. When we look at lab testing, we see it in diabetes. We see it with cholesterol as well, high blood pressure. But we have the findings, and then so it's important as a provider to talk to the patient. Hey, this is your condition. This is why we need to do this treatment or that treatment or whatever it may be. And so just relating that to the patient and relating that to our colleagues is going to be very important in how accurate and precise the measurements are from the osmolarity. That's why I've utilized it, and that's why I will continue to utilize it. Be even more excited when I get the portable unit.
Perfect. Okay. Well, thanks all for joining us, and we look forward to sharing more in the future with you.
Thank you.